Supraventricular tachycardia, or SVT, is one of the most common arrhythmias in young children. It can turn a little heart into a racing engine without warning.
This Medmastery lesson will show you how to detect the subtle ECG signs of SVT in pediatric patients, giving you the tools to spot this arrhythmia when it matters most.
In this lesson, we will visit the neonatal intensive care unit. Our patient is a 3-day-old baby in tachycardia. An ECG was obtained, but the rhythm assessment is a bit tricky for this patient. At first glance, it is difficult to find any P waves, but a zoomed-in version shows a little tiny deflection after the QRS complex that might be a P wave. It is very difficult to see the P waves in this ECG, let alone determine if they're upright or inverted. Interesting. Let's move on to the rate. This ECG indicates a super fast heart rate of about 250 beats per minute. This is definitely not normal, not even for newborns, whose heart rates typically range from 100 to 160 beats per minute. Next, the QRS axis is normal, with an upright QRS in leads 1 and AVF. Now let's look at the intervals. The PR interval is a bit tricky since the P waves seem to be coming right after the QRS, making it difficult to evaluate them. If we look at the QRS complexes, they appear narrow. Collectively, these findings, a narrow QRS and P waves appearing after the QRS complexes, indicate a regular, narrow, complex tachycardia, a very common arrhythmia in the very young. This baby has supraventricular tachycardia, or SVT. Supraventricular tachycardia, or SVT, is an umbrella term for many different arrhythmia mechanisms, all arising from the atria. It turns out that a regular, pretty fast, narrow complex tachycardia in newborns is almost always something called re-entrant supraventricular tachycardia. Essentially, the electrical conduction in the atria short circuits. Instead of simply traveling from the atria to the ventricles, an accessory pathway allows the electrical impulse to re-enter the atria, creating a loop or circuit. When this happens, the heart beats very fast. If left untreated and unrecognized, patients can develop more serious symptoms related to heart failure.
Parents often wonder why their seemingly healthy baby developed the heart problem. The explanation lies in how the heart forms in utero.
During early development, the atria and ventricles start out as a single unit. As the fetus develops, the atrium and ventricles slowly separate from one another. And during development, primitive conduction pathways initially connect the atria and ventricles, but most of these pathways disappear as the heart matures, leaving only the AV node and his Purkinje system. But sometimes a remnant conduction pathway persists as an accessory pathway, allowing a re-entrant circuit to occur even after birth. I use a pizza analogy to explain this. Imagine taking a piece of pizza. As you pull the pizza slice away, tiny strings of cheese remain attached. These strings of cheese are like the accessory pathways. In many babies, these extra connections will eventually go away on their own. But before they do, they can cause arrhythmias like they did in our patient.
Most babies with SVT in infancy will be treated through the first 9 months of life or so, hoping that these connections just vanish on their own with continued heart development. That's exactly what we did for our patient. And after 1 year of life, she no longer had SVT.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.